Dr. Obuhanic traveled all the way from the Olympic Peninsula. She lives in the sunny town of Port Angeles, though she's originally from Ukraine. She holds a PhD in immunology from the Rockefeller University in New York. She has held postdoctoral appointments in prominent immunology laboratories affiliated with the Harvard Medical School and Stanford University School of Medicine. She lectures frequently at conferences and educational events throughout North America, and she is a founding director of Physicians for Informed Consent. What a coincidence. There's a slide behind me now. It's a nonprofit organization of doctors and scientists dedicated to safeguarding informed consent in vaccination. Please welcome Dr. Tatiana.
Well, I was supposed to introduce Pig, but you already did it for me. Okay. So, Physicians for Informed Consent is a nonprofit organization that was formed in 2015 in response to California law SB 277. And you might know there was a saying that there is no doctor out there who would be against mandatory vaccination, that all doctors believe so much in vaccines, in this being safe and effective, that mandatory vaccination is just what all the doctors would go along with. And the existence of this organization is the statement to the contrary. And our organization is new, and it launched to the public last November, but we are growing, and we are assembling the doctors together. We are uniting the doctors who are now also learning about the risks. They're educating themselves and educating their patients as well. Because as you know, medical profession has been kept in the dark as well about vaccine risks. So in addition to uniting the doctors, our mission is also to educate the public about infectious disease, immune system, and informed consent, what it means to give an informed consent. And we have membership levels, not only for physicians, but also for other doctoral professionals. That would include PhDs, JDs, doctors of chiropractic, naturopaths, any healthcare professionals, as well as complimentary public membership. So anyone can join, sign up for the organization to support our mission, and please make PIC a household name, because this is how we are going to change medical culture. So today my topic is the immune system. And Jennifer covered a lot of that. But in addition to that, now I will show you why Jennifer was right and how all the nutrition and Tylenol and everything she talked about, how it plays a role specifically in the immune system. Because it's one thing that we take these measures and we see the evidence in our kids that they stay healthy, and they can handle infections. So we have empirical evidence for that. But the other side demands science. So here we will go through science, and we will see that science supports the fact that the immune system can handle infections. So who should be interested in this information? Is it only for those who chose to remain unvaccinated or who chose not to vaccinate their kids for any reason, be it medical or philosophical or religious? Yes, those people should be interested in this information so that they don't have to live in fear of infections. They don't have to live in fear of mumps, measles, scary chickenpox, horrible cases of chickenpox. Well, yeah, we are laughing, but some cases could be horrible, as we know, and it doesn't need to happen. So, but there is another group of individuals, pretty much the rest of us, those who got vaccinated, and should those be off the hook now that they're vaccinated? Should they stop worrying about infectious disease? Actually, no, because there is always a possibility of a vaccine failure. And I've been a victim of vaccine failure myself, so I know this really well. I've been fully vaccinated for measles, and I got it anyway. And this is what got me started to understand why, first of all, vaccines fail, and second, how to take care of the immune system, that in case vaccine fails, you can still survive that infection. And so what I discovered while doing my own research about my own vaccine failure is that there are two reasons why vaccines fail. First is called primary vaccine failure, is when vaccine fails to induce antibodies, and that usually happens if a person is immunocompromised in some way. But there is a bigger problem, and that is waning vaccine immunity, and that is called secondary vaccine failure. So in that case, the immune system responds to the vaccine, produces antibodies, but then those protective antibodies wane. They go away, and at the time of exposure, you might not have adequate levels of protective antibodies. So even though your vaccine worked originally, it doesn't generate long life immunity just like natural infection does. And so one could go through vaccination, take all the risks, and then get the disease anyway. So in that case, we do need to worry about how to take care of the immune system, pretty much everyone. And I will talk about these 7 particular factors that affect immune defenses. And everything was on Jennifer's list already. So we will go into scientific details on each of them. And let's start with nutrition, with vitamin A. So vitamin A deficiency is one of the major factors affecting the immune system. Let's see where it plays a role. So let me tell you a little bit on immunology here. There is a very important pathway in the innate immune system. It is called interferon pathway. It's an antiviral defense mechanism. So what happens when a virus enters your body and infects the first cell, which is usually a leukocyte, a cell from the immune system? The virus not only replicates itself and makes more copies of itself, it also makes the leukocyte produce a substance called interferon. And then that interferon secretes and kind of diffuses from that original leukocyte to nearby cells and informs the next cell around through what is called signal transduction that there is a viral infection going on in your body. And that second cell now upregulates antiviral defenses. So now, if the virus infects the cell that has been interferon stimulated, the virus cannot replicate there. So there are antiviral defenses there that block viral replication and further spread of the virus through the body. Now, this pathway is so extremely important that if they disrupt interferon production in animals, such as mice in the laboratory, any benign virus can become deadly, okay? So this is really, the interferon pathway is one of the major ones in the immune system. Now, what does this have to do with vitamin A? So let's bring vitamin A back. And it turns out that vitamin A is a partner of interferon. So if you have tons of interferon but not vitamin A, it's like you don't have interferon. And it has been shown vitamin A, more specifically retinoic acid, not beta-carotene, so we have to make that distinction. The active form of vitamin A was found to inhibit, in a test tube, replication of the measles virus, mumps virus, and enterovirus 71. Who knows what that is? Okay, we will get to that. It's a causative agent of hand, foot, and mouth disease. In China, though, not here. Here we have Coxsackie virus A that causing very similar disease. So mainly this is a virus in China. And because this is such a broad effect for these seemingly unrelated viruses, it is very likely that this effect is relevant to all viral infections. This is a generic pathway in the immune system that protects us from the viral infection going really rampant throughout the body and infecting too many cells, causing fatal damage to our vital organs. So now we can look at global statistics on vitamin A deficiency, and maybe it will start making sense. Where do children die of measles most? That's in places with vitamin A deficiency, where the vitamin A deficiency is rampant. So here is a recent study published in Lancet Global Health. And what the study says is that vitamin A deficiency is a risk factor for mortality from measles and diarrhea in children. And Garth specifically asked me not to ask him to run around so that someone can read it, so I will do it. You can read along with me. In 1991, 39% of children aged 6 to 59 months in low-income and middle-income countries were vitamin A deficient. Okay, 39%. Now in 2013, it was down to 29%, but still very high. And the majority of that is, happens to be in sub-Saharan Africa and South Asia, as we would expect. Now, also 94,000 deaths from diarrhea and 11,000 deaths from measles were attributed to vitamin A deficiency. So is it the fault of the measles virus, or is it the fault of vitamin A deficiency that's causing these deaths? Now, and how do we solve it? Do we go after the measles virus and eradicate it, or do we eradicate vitamin A deficiency? Because if we address vitamin A deficiency, it will not only lower or remove mortality from measles, but it will also lessen other viral diseases and their burdens. For example, now we are going back to enterovirus 71, the ones that's causing hand, foot, and mouth disease. And there in China, the study was done to look at the severity of disease in relation to vitamin A status of children. And lo and behold, it was found that vitamin A insufficiency was associated with more severe illness. So just taking care of vitamin A deficiency would drastically improve children's health around the world. And in our country, we have all the means to provide our children with vitamin A-rich foods so that we don't have to live in fear of the mumps outbreak or measles outbreak or any other viral disease out there. So now, nobody would argue against vitamin C deficiency as a major factor in your health. But let me just show you how important it is, so that it's not just lip service. This was a study done in mice in which these mice were rendered vitamin C insufficient. And so the way it was done is by having them removing vitamin C from their diet for only 3 weeks. And then, so on this side of the slide, so there are two groups and no infection. There was no infection that these mice were challenged with. And these are survival curves. And 100% survival means that all the mice are surviving. So vitamin C insufficiency in itself doesn't kill you or animals. However, here on this side, these two groups of mice were challenged with influenza A virus. And so what we see that the group that was vitamin C sufficient lives. The group that was vitamin C insufficient, 50% of the mice dropped dead on day 1 after infection. Okay? And a few more dropped on day 5. So now, let's look at some public health statistics. So this, with our understanding of what vitamin C is doing. And actually, let me back up a little bit, go back. And so important finding that they made in these mice, in vitamin C insufficient mice, was that these mice were not able to induce interferon production. Normally, as we know, when the virus enters the body, the immune system starts interferon production within hours of viral entry. It didn't happen in these mice, and they dropped dead. Okay. So here, this study was published in 1999, and this was done by the CDC. So this is official statistics, not any anti-vaccine propaganda. But here what we see, the mortality rates from infectious disease were dropping significantly all the way to the 1950s. Then there wasn't much further decrease. This is when all the vaccines came in, yeah? So this is how vaccines save lives. No further decrease in infectious disease rates. Okay, so what was the most common disease that would result in death? Pneumonia and influenza. okay? Not measles. So now, at this time, there was no refrigeration and no transportation of vegetables from Mexico to northern states so that you can have your vitamin C all year round. So it is very possible that people were vitamin C deficient during winter months because they would have to rely on local produce, and unless they make sauerkraut or collect rose hips for their winter, they would not have vitamin C in their diet. And that would improve as we approach our modern age. So is it possible that the majority of these deaths could have been avoided with just people being sufficient on vitamin C? And maybe that's why the rates are going down. Or maybe it is antibiotics. Who knows, because pneumonia is there. So let's see if it's antibiotics. Now, let's discuss antibiotics. And the way it is done now is that we start to understand that overuse of antibiotics is not really a good thing because it causes antibiotic resistance. But in practice, when you go with a respiratory infection, it is not really clear whether that respiratory infection is bacterial or viral. And you would be prescribed antibiotics just in case. Because I think the assumption is if it is bacterial, which they can only determine 12 hours later with a test, with a culture, then antibiotics would be helpful. But the assumption if it's viral, then it's not going to be useful, you know, but at least that it's not going to be harmful. And that is not true. So here is data from mice. Again, mice were pre-treated with antibiotics for 3 weeks, and then they were challenged with influenza A virus. And so what was observed in those mice relative to controls is that they had defective responsiveness to interferon, delayed viral clearance, more severe bronchial degeneration, and increased mortality. So what we can conclude from this is that antibiotics actually makes it worse for a viral infection. It's not neutral. And then there was another study which was very similar in design, but it was done with probiotics instead of antibiotics. And it showed the exact opposite result, in that if mice were on probiotics for 3 weeks, and then they were challenged with influenza, they had enhanced interferon responsiveness, lower rates of viral replication, which is related to interferon responsiveness, less inflammation, and better survival. So now, how does this, is this related to humans? So is this only related to mice? It is related to humans as well. So at least on the side of probiotics, we do have a study that giving children probiotic supplements during winter months reduces incidence of fever, cough, and runny nose, all these flu-like symptoms, by a significant percentage relative to placebo. So now we are a little bit clear on how to handle a winter season. Now, another interesting point that I researched, which is not mentioned in textbooks of immunology, at least I never remember reading that, is that our immune system actually is capable of producing natural antibiotics. And those, the scientific name for that is antimicrobial peptides, so AMPs. And they act just like synthetic antibiotics in that they interfere with various functions in bacteria or in invading bacteria, but they are not toxic to you, they are not destroying your gut, and bacteria do not develop resistance to these natural antibiotics. They were selected or produced through the process of evolution, and there are so many of them. There are probably 700 different ones throughout the mammalian species, so there is no way bacteria would develop resistance to all of them. And the good news about AMPs is that they're acting not only against bacteria, but also against the flu virus. So now here we have an example of natural antibiotics that's addressing two things together, the flu and invasive bacterial disease that often comes after the flu. Well, not often, but it may come after the flu. So now what's the catch? Why is it that if we are capable of producing our own natural antibiotics, why do we have the flu, or why do we have pneumonia? And the catch is this, okay? So these natural antibiotics will only be induced if you have vitamin D in your body. So that's where sunshine comes in, and that's why you don't have flu during the summer. The flu virus just doesn't disappear. It's here all the time, but we don't have the flu symptoms during the summer because we're having natural antibiotics up in the summer. And it is good to keep that up through the winter season with vitamin D-rich foods. And we are so married to supplements, which is okay, but how did people do it in the past when there wasn't any supplement industry? Let's talk about Eskimo and their polar night. For 6 months, what did they do? Well, they had something yucky called fermented fish, and that's what was making them really healthy. So, so there are some yucky foods out there, fermented cod liver oil, that are rich in vitamin D. I consider that food, not a supplement. If you are not really interested in that, I'll have another option for you. But let's first look at vitamin D, where we are. Vitamin D deficiency, okay. So there are some studies on whether vitamin D supplements help or do not help with reducing the incidence of influenza, and yes, it does help. There was a study in Japan, that's the first one on the list, that reduced the incidence of influenza by 42% relative to placebo. This is not 100%, but this is something and is better than the flu shot, right? So, but then there was some heterogeneity in studies. Some studies would say vitamin D is helpful. Other studies say it's not helpful. So finally, the British Medical Journal did a systematic review of these studies to try to see what is the pattern. And they found that vitamin D supplementation was helpful to people who were vitamin D deficient to start with. Those who were not deficient to start with, vitamin D supplementation didn't help. Also, taking bolus doses, meaning mega doses of vitamin D, wasn't very helpful either. It was much better to take small doses over daily or weekly. So now, if you are sufficient on vitamin D, but you are still having problems like frequent colds or susceptibility to flu, maybe you have a susceptibility in something else, not in vitamin D. And indeed, vitamin D doesn't act alone because it's not technically a vitamin. Some people call it a hormone. And the reason for that is because it binds to its receptor, its partner in the body called VDR, vitamin D receptor. And then this vitamin D receptor is activated to upregulate antimicrobial peptides, to upregulate your natural antibiotics. So vitamin D will not do that directly. So there is a possibility that you have plenty of vitamin D, but you don't have enough of vitamin D receptor in your body. Then it's not going to work. How do you make sure that you have vitamin D receptor? What increases vitamin D receptor is probiotics, okay? So again, either you have healthy gut with plenty of lactobacteria in there, or you take some supplements just like that other study, the supplements, to upregulate your VGR. So if you do take vitamin D, please also think about vitamin D receptor. And on the negative side, black mold is known to decrease vitamin D receptor. So when people live in moldy buildings and have sick building syndrome, it might be because their vitamin D receptor is suppressed and the whole vitamin D signaling is not really happening. Now, I promised you that there is an alternative while you're figuring out your vitamin D receptor situation. Turmeric. Turmeric, which is the active component in turmeric is curcumin, as we know, also known as phytonutrient. That component is known to induce antimicrobial peptides, which is called cathelicidin. So that's one of many antimicrobial peptides. So that would be a good one to consider during the winter season as well. And also it is known, it was found that curcumin can inhibit infectivity of enveloped viruses, which includes influenza A virus. So the next one is glutathione. And we discussed glutathione a little bit, but I would like to maybe add to that, to what we have discussed. So glutathione is body's major antioxidant, detoxifier, chelator of heavy metals. Different people have different capacity to produce glutathione. You cannot really get it from the diet because even if there is a source of glutathione in the diet, it's a little peptide that will be chopped up in your stomach just like any other protein is chopped up. So you really need to ramp up the ability of your body to produce it. But for this particular talk, the most important function of glutathione that I want to focus on is that it is an immune modulator as well. And what exactly does it modulate? Several things. The one that I want to describe is the function of neutrophils. What are neutrophils? It's another type of white blood cells, and the main function of neutrophils is to kill bacteria by ingestion, which we also call phagocytosis. So sometimes you can see a really nice movie on Facebook where you see a neutrophil crawling after bacteria engulfing it, destroying it, digesting it. So that's neutrophils patrol our blood and also the lung. And if you have a cut, neutrophils come to that injury site, and if there is any bacterial cell that enters the cut, they are the ones responsible for taking care of it. So neutrophils are very important. Interestingly enough, depending on whether neutrophils have enough glutathione or not enough glutathione, they act very differently. So if neutrophils do not have enough glutathione, they are incapable of phagocytosis. They are completely reprogrammed. They become a different entity whatsoever, and instead of phagocytosing bacteria, they are inducing inflammation and lung tissue damage. So they would be contributing to exacerbations in the lung, pulmonary exacerbations. And it was shown that if one normalizes the levels of glutathione in patients, that prevents pulmonary exacerbations. Now, and what do we do when we are sick? We give children and we ourselves take Tylenol, right? And we know what it does. It depletes body stores of glutathione. That would predict that Tylenol would increase the risk of bacterial infections by depleting glutathione. And this is exactly what a Japanese study found, that frequent dosing of children with acetaminophen or Tylenol during febrile illness was found to increase the risk of developing pneumonia. So we have enough understanding in immunology to explain why this is the case. So then there was a question of ibuprofen. Is ibuprofen any better? Ibuprofen does not develop glutathione, but it does other things which are also bad, and that it is being an anti-inflammatory medicine. So French doctors published a warning not to give ibuprofen during chickenpox specifically, because what may happen is that as children scratch their lesions, they may introduce bacteria, right? And then usually it's an inflammation that takes care of those bacterial infections or any bacteria that would enter. Now, if you have the inflammatory process blocked, they get super infections. So you can see sometimes those pictures of secondary bacterial infections that happen in children with chickenpox when it becomes extremely severe and it is not the normal course of chickenpox. So the warning was not to give ibuprofen during chickenpox specifically. Our next component is sugar. And where exactly sugar plays a role in depressing your immune system, again, it relates to neutrophils. Neutrophils that phagocytose bacteria. Bacteria is supposed to be their main meal, but if you give them sugar, they would prefer that. So instead of eating bacteria, they would just load themselves up on sugar. Let's remember, they're like little kids. They're going to eat dessert. They're not going to eat their main dish. So this was found back in 1973, that when healthy volunteers were given a high sugar meal, which consisted of 100 grams of either glucose, fructose, sucrose, orange juice, or honey, and then their neutrophils were taken out from the blood and tested for their phagocytic function, they found that it was decreased by twofold, and that decrease lasted for 5 hours. It took 5 hours for neutrophils to recover back. So if you indulge on sugar occasionally, that might be okay, but if you are already sick, you're having a viral infection, you might be going towards a bacterial infection, this is not a good thing to do. So don't eat ice cream when you're sick. Now, finally, formula feeding is another factor that affects immune system of the babies. Now, so we know that breast milk is not just food, it's also immune defense for babies. And there is just so many components that would not ever fit on one slide that have immunologic relevance in breast milk. So breast milk has antibodies, it has other immunologic factors, it even has cells, and even beneficial bacteria, lactobacteria, were found in breast milk. So all of that is being transferred to the baby. And the levels of cells, of leukocytes, are even fluctuating based on the baby's needs. For example, if there is an infection either in the mom or in the baby, the numbers of leukocytes in breast milk increase. And what we are doing, unfortunately, is that we are handling breast milk too much. And sometimes it is indeed a necessity when someone needs to express it, freeze it, thaw it. It is often a necessity, but we shouldn't let it become a fad, because what it does, it actually damages cells. So freezing and thawing damages leukocytes. They would not survive that. Also, excessive heating would destroy other components, rendering breast milk pretty much just being food and nothing more than food. So, so now let's look at some of the scary diseases and how formula feeding actually increases the risk. So let's start with the disease that is not as scary, but pretty common here, ear infections. So here we have 3 groups of children who were either, it actually doesn't show really well on the slide, but they were either breastfed exclusively, breastfeeding plus formula in combination, and this one was, actually no, so this one was formula and this one was a combination of breastfeeding and formula. So you see that the cumulative risk of ear infections was the lowest in the exclusively breastfed group and the highest in the exclusively formula-fed group, and somewhere in the middle for the combination. Now, here's some data on pneumonia, in Brazil specifically, where pneumonia is very rampant. So in Brazil, formula-fed infants under 3 months of age were 61 times more likely to develop pneumonia compared to exclusively breastfed infants in the same age group. And older babies are withstanding pneumonia better than younger babies, but there was still a big difference even in the older age group, 3 to 9 months. Now let's go to another disease that is even scarier, and that is Hib meningitis. So here, this was done in Sweden, and it was found that there was a 4-fold higher risk of Haemophilus influenza meningitis in infants with short duration of breastfeeding, and that you would need at least 13 weeks of exclusive breastfeeding to make breastfeeding work in protecting from Hib meningitis, and that statistically, that protection was observed beyond the duration of exclusive breastfeeding itself. So somehow, breastfeeding changes microbiome in such a way that then it goes on protecting the baby from Hib meningitis. Now, another study from Sweden shows some interesting trends. So what is shown here is the breastfeeding rates and the rates of Haemophilus influenza meningitis. So you see, as the breastfeeding rates are going down, all of a sudden, Haemophilus influenza meningitis shoots up. So interestingly, in the earlier parts of the 20th century, Hib meningitis wasn't even a thing, okay, because babies were breastfed. And it's a formula-made disease. And here in Sweden, once the rates of breastfeeding are reversing, you already see how Hib meningitis is going down. They introduced vaccine in 1993 in Sweden, okay? And then it's the vaccine that takes the credit for eradicating Haemophilus influenza type B, which it did. But it could have been accomplished by just going back on the, up on the breastfeeding rates. Okay. So building a strong immune system comes down to these relatively simple steps. It's consuming nutrient-dense food, lacto-fermented food, minimizing the use of antibiotics as much as we possibly can, replenishing glutathione, avoiding to deplete glutathione through medications, minimizing sugar consumption, breastfeeding the babies. Everything Jennifer told you already. So, but now you have the science behind it. So you know it's not just talking, it's scientifically accepted. Okay, so now can we combine this really healthy lifestyle and on top of that also vaccinate? Why not? So here's why not. There are some vaccine ingredients, which we already discussed, aluminum and thimerosal specifically, that are very problematic. Not only because they're neurotoxic, but in how they affect the immune system itself, because that is often overlooked. So let's start with aluminum. Aluminum's effect on neutrophils. So you remember what neutrophils are? Important cells that are phagocytosing bacteria, preventing bacterial invasive infections. Well, it turns out that a few details that I want to fill you in so that you understand the rest of it is that these cells are turned over very rapidly. They only live about 7 hours. And they kept being produced from the bone marrow to replenish whatever comes out and being, being cleared. So when you have a viral infection, the body produces interferon. And interferon actually reduces the number of neutrophils. It kills off some % of neutrophils. And that might be the reason why when someone has a viral infection, there is also a tendency to sometimes develop a bacterial infection later on because of that vulnerability. Now, what happens with aluminum? This experiment was done in mice. When aluminum was injected in mice, it was found to deplete bone marrow reserves of neutrophils for 2 to 3 days. So what it comes down to, if someone is already being sick with a viral infection and having some interferon in their body, and they're being taken to the doctor, and the doctor says, oh, let's catch your baby on vaccines now. So they're injecting the baby with aluminum that creates an emptiness in the bone marrow. Now it's a really big vulnerability. These two factors in combination, this is what we observe really. This is what throws the baby into this constant cycle of viral infection turning bacterial, for which the baby would need antibiotics. What do antibiotics do? They compromise the gut, and that's not only bad for the gut itself, but also for antiviral defenses. Remember, mice that were treated with antibiotics, they were not handling influenza very well. So then you have another cycle of exacerbated viral disease followed by another cycle of potentially bacterial disease. And we have babies that go through multiple rounds of antibiotics during their first life, and we know, first year of life. We know where this is going. Thimerosal. So this was already mentioned, but I would like to add an immunologic detail. The paper that came out that said that thimerosal is an immunosuppressant this is a quote from the paper. Cell-based analysis indicated that thimerosal can effectively reduce ERAP1-dependent cross-presentation by dendritic cells in a dose-dependent manner. To me, as an immunologist, what jumps out is cross-presentation by dendritic cells. That's what I care about. So what is that? What is cross-presentation by dendritic cells? So it is depicted here. So when you have your cell infected, there is an important component in the immune system called dendritic cells. They are what is called professional antigen-presenting cells. They pick up bits and pieces of the virus, and they cross-present that to T killer cells to activate them. Without this event, T killer cells will not be activated. And what T killer cells do when they're activated, they go and they find infected cells and they kill them off, and this is how viral infections are cleared from your body. If this thing doesn't happen, you will have lingering virally infected cells. So that puts the action of thimerosal in a whole new perspective. What are we doing to our immune system when we are loading ourselves on thimerosal? So let's see how it comes down together. We know that vaccines depend on the immune system in order to work. Because, well, in other ways to say, the immune system is being exploited by vaccines. Vaccines stimulate the immune system to produce antibodies, and that's all that what the program cares about is about antibodies. But it's not true the other way around. The immune system does not depend on vaccines in order to work. It depends on all these other things. And not only that, but that some vaccine ingredients, specifically aluminum and thimerosal, are not only neurotoxic, but they also prevent the immune system from working properly. So even though you may end up with antibodies which sooner or later will run out, you end up with an immune system which is not as functional as it should be. Now, so we place vaccines in the middle of this debate. And what I see happening is that this focus on vaccines is what really shatters our communities of parents, communities of doctors, into all these various factions. And even within people who understand vaccine risks, there are also factions that are fighting with each other, because some are too anti-vaccines, others are vaccine choice, and so on and so forth. And what if, instead of putting vaccines in the middle of this, we would put the immune system in the middle? What would happen to all of us? We would not be divided anymore. Everyone would be pro-immune system. There is nothing to be against about or to be hesitant about. So, and I think this is the future of immunity. Thank you.
As I understand it, the basic idea of vaccines in protecting us is that they generate antibodies. Can you talk a little bit about that? Because I also understand, for example, when I was, as a parent, doing my initial research, I encountered a study as far back as 1950 that was suggesting, I think it was with diphtheria, where they were saying that they had people with high antibody levels who were exposed and got sick, people with low antibody levels who were exposed and didn't get sick, suggesting that antibody levels alone does not equal immunity. Can you talk about that? As the immune system a bigger system, and antibodies is clearly part of it, but.
So I think I might know which study you're referring on diphtheria, the old one, and if that's the same study, that study wasn't really well done because they were measuring titers when people already had diphtheria. So that titer could have come from disease itself. But now, on the other hand, there was a more recent study on measles, which was much better done because they were measuring titers prior to. And they measured antibody titers, as you said, and their medical personnel, because they have to screen them from time to time to see if they're still positive by titers. So they had medical personnel who were positive by antibody titers from their vaccines, and they still got measles. Okay? So then the thing about antibody titers, that there is a separate technique that is being used in immunology to measure protective titers as opposed to antibody titers. And they do not always correlate. So you might be positive by antibody titers, and all it means that you have some antibodies that bind to the virus, but it doesn't mean that these antibodies will protect you. They might bind to the virus in such a way that would not block viral entry into the cell, for example. But there are also protective titer studies, and we know that protective titers wane pretty rapidly after immunization. Yeah.
We have the nice person with the microphone. Could you ask? We have plenty of time for Q&A here, so don't worry. I promise to get to you.
So I have two questions. First of all, there's a lot of controversy on how to increase intercellular glutathione. IV NAC plus vitamin C, IV glutathione, nebulized glutathione, transdermal glutathione. So I want your answer on that. And then can you explain the difference between giving essential fatty acids versus non-steroidal Tylenol and what have you for pain and inflammation in its regards to prostaglandins?
Okay, so this was lecture on immunology, not on nutrition. So I think your best resource on nutrition would be nutritional specialists. The way I'm thinking about glutathione is that there are ways to obtain it from the diet, and the diet which is Weston Price Foundation, where you have raw milk, if you can handle raw milk, but it could be from goat or from other species, that there is something in raw milk, in the whey portion of the milk, which is a precursor. It is called gamma-glutamyl-cysteine precursor. And the studies were done in rats, I think, where they used raw whey protein versus denatured by heat, and there was a difference in intracellular glutathione levels in those rats. So that's one way to go after boosting your glutathione. But also it is possible to convert homocysteine into cysteine inside your body, and then cysteine becomes the precursor for glutathione. And this is where MTHFR mutation plays a role, so some people may not be able to do that as effectively or efficiently as others. So you really need to know your own genetics and see what's the best for you personally in how to boost your glutathione. And obviously not to deplete it would be a good start. And the second question was on, I already forgot what
Tylenol.
Prostaglandins. Okay, so this is getting really complicated in terms of managing pain. There was a study, let me take you out of sciencey stuff into something that appears to be working and was documented in a clinical trial where they compared management of ear pain from ear infections. In children, there were two groups. One group was being treated with homeopathic remedies, which were specifically prescribed individually according with homeopathic theory. And the second group was treated with analgesic, the conventional medications. And so what happened is that the group that was receiving homeopathic treatments, they recovered from their ear infections without needing antibiotics. So they were able to manage their pain, however it is playing out with prostaglandins and all these scientific stuff, without having to rely on antibiotics. And that means that their immune system was capable of dealing with it. Now, it doesn't necessarily mean that homeopathics did it, but what it means is that antipyretics, the conventional drugs, they actually suppress the immune system. They prevent it from doing its antibacterial functions. Then you require actual synthetic antibiotics to do it.
A question here?
Yes, I have a question from a friend who asks, does the MMR vaccine shed after immunization? And if so, are those people at risk for spreading it?
MMR vaccine does indeed shed. It was documented. It's a live virus, so the virus can be shed through urine, as well as it could be found in the throat, meaning it could spread that way as well. Now, the medical establishment is trying to keep the information down on whether that shedding is actually infectious, whether those particles, those viral particles that are being shed, whether they're infectious. Theoretically, yes. Practically, we don't have anything in PubMed, for example, or that I could find on examples of that. However, there was a very interesting case in Canada that was published in mainstream report, not published, but it was featured in mainstream report. There was a girl who developed the signs of measles in Canada, and she was vaccinated by a long time ago, maybe a year ago or so, so it couldn't be from that particular vaccination. That was way too long. And when they sampled the virus that was in her throat, it was a virus which was from the measles vaccine strain virus. So the only explanation is that she got that from somebody who was recently vaccinated and developed measles symptoms from that. The way they interpreted it is that that measles virus from the vaccine that they found in her throat is there coincidentally, and the disease she has is no longer called measles. It's something else, some kind of viral rash. It's not the measles anymore, so she was even struck down from the measles reporting system. And so this is how they explain away things that don't fit into their narrative.
All right, that's nice to know. We have a question over here.
I had a question on herd immunity. So as I'm sure everyone here knows, I mean, it's a huge justification for vaccinating everybody. We have to get everybody to 95%. And you mentioned earlier on the secondary vaccine failure being waning immunity. I was wondering if you could speak to just in general, if it varies between individuals, just how long vaccine immunity lasts, because we hear, I mean, most people in this room, I'm guessing, haven't had a vaccine. And I mean, I was vaccinated when I was, like a child. And so nobody talks about how our population is pretty much unvaccinated. And they make a big deal about children not being. So I was wondering if you could speak to that.
Well, so the telltale sign that vaccine immunity wears out is that the majority of people who got measles during Disneyland outbreak were adults. 60% were adults. And in pre-vaccine era, there wouldn't be such a thing. Everyone got their measles by the age of 15. So somehow the window of vulnerability has shifted. So that's obviously is consistent with the idea that vaccine immunity doesn't last. So when you actually look at numbers, and you probably can see one of my YouTube presentations on that, there are, among people who respond, who are responders, there are low responders, high responders, intermediate responders. There is a whole range of people that do develop titers, and then those titers slowly go away at different rates in those different groups. So someone who is a low responder, they can get back to being susceptible to clinical measles within 2 to 5 years. Someone who is high responder may take a few decades, which is not necessarily a good thing, because by that time you're an adult or even elderly, and that's not a good time to have measles. So, and so basically, why is it that we don't have massive measles outbreaks? Well, because right now measles is an imported disease. It's no longer endemic. And the public health officials take really good care about isolating, quarantining, and doing all of that to prevent the spread. In Canada, there was an outbreak in Quebec. That province was vaccinated at 95 to 97% level of compliance without any pockets of unvaccinated, refuseniks. And basically, the outbreak over there was big, and it lasted 6 months. And the reason was because the public health officials were so certain that there was herd immunity, that they didn't do any quarantine, any isolation, any other measures. They thought that the outbreak would get extinguished by itself, and that didn't happen. So therefore now they're doing really strict measures with all these quarantine procedures, and they're telling us that herd immunity is still here. Yeah.
Okay, in the back, where'd she go? There she is.
Hi. Thank you for your presentation. I'm actually studying naturopathic medicine and public health at Bastyr University, and I don't feel like we get a balanced training, so I appreciate being here. Turmeric was mentioned a few times, and I just want to put a plug in there that black pepper increases the absorptive capacity of turmeric by 2,000%. So if you're going to eat turmeric, eat it with black pepper.
That sounds a good meal, actually.
Yeah. And then my question for you is that I've heard that for those exposed to a lot of toxins, like mothers exposed to a lot of toxins, that can basically dump into the breast milk and then be transferred to the child. So do you have any, can you speak to that?
Yeah, well, one toxin that mothers are transmitting to their child is the aluminum, and it's probably from aluminum perspirans. So we could really work on eliminating, or at least limiting that, and of course paying attention to what we eat and our own detoxification system and how to boost that. But still, to me, it seems like the benefits of breastfeeding would outweigh that, but we really need to work on contaminants as well.
We have a question here, and then I'm going to go to the other side of the room. Don't worry, I see you. Don't worry.
First off, thank you for your work. I'm a chiropractor in Seattle, and I guess my question is, could you comment on the increase in type 2 types of illnesses like cancer, autoimmune, and in association to vaccines and upregulating the type 2 immunity?
Okay, so let's start with cancers. And so let's pretend there are no carcinogenic substances in vaccines. Okay, and let's focus on a slightly different aspect of that. It was shown that childhood diseases, measles, for example, reduces the risk of lymphomas. Okay, mumps reduces the risk of ovarian cancer. Chickenpox reduces the risk of glioma. Whooping cough reduces the risk of leukemia called AML. I don't even know what it stands for. So now that we don't have these diseases on a regular basis, it's not that the absence of disease causes these things to show up. There might be other causes, but the absence of disease is actually making it more likely that the cancer will manifest, right? So there would be nothing there in the immune system to do some surveillance or to eliminate some cancerous precursors. Another topic for cancer is that cancer has that mechanism. Cancer cells have that mechanism that they can be killed by heat, by fever. But because fever resets a signal transduction pathway in cancer cells, so that now the immune system can come in and kill it. Without that pathway, the immune system cannot kill it. Okay, so in the past we had plenty of feverish conditions in children. Now we are using Tylenol and everything else to try to suppress it. I think we are just allowing whatever cancer cells that might be there as precursors to eventually start growing.
Question over here in the back. Sir, you have the microphone in your hand. You actually get to speak.
I see. I think it's really interesting that general public, they all know that it's a fact that after vaccination, you're very vulnerable to flu. That's a fact, but nobody questions why or try to get in detail. Mm-hmm. But your last point, it totally makes sense. Like aluminum vaccine, it empties your bone marrow, which is like a storage for your white blood cell. That is correlated to the level of your antigen. So basically, if the scientific lab shows that, this vaccine empties your bone marrow, and at least for 2 to 3 days after your vaccine, your bone marrow level and your white blood cell level is really low. Like, shouldn't people know, or shouldn't vaccine state in their description that after your child gets vaccinated, your child's gonna have really low immunity to anything. So you're letting your kid be at a risk for having this vaccine, at least for 3 days, a certain period right after your vaccine. Why doesn't vaccine state that on their description?
So that study was done in mice. And I can see how there might be a resistance by vaccine manufacturers to take that information and somehow assume that it's the same in humans, right? They can say, well, that's just happening in mice. We didn't check that in humans. That would be a very invasive experiment to do in humans because one would have to take samples of bone marrow. So, but the immune system in mice is very similar to mammalian immune system is very similar. That's why we study mice, and we assume, unless we have some other indication to the contrary, that the mechanisms are very similar. But you can see it from real-life examples of what's happening when a healthy baby goes into doctor's office. Not only they're exposed to all kinds of germs in there, they're getting vaccinated, and they also create the vulnerability is being created with that, potentially, and we see the results of that. Now, however, I would like to say specifically about the flu shot. There is no aluminum in the flu shot, and people do indeed get sick after getting a flu shot. They have what seems to be a flu. There might be another explanation to that, and I wrote a blog about that. If you might remember the story of Daniel Nadis, Dr. Daniel Nadis from Cleveland Clinic, who actually said that's what he took a Thimerosal-free flu shot, and the next thing he knows, he has the flu for several days. And he was thinking maybe it's formaldehyde or something else. But another way to explain it is that there is a concept called negative phase in immunology. And what it does, if you already have something going on, let's say maybe already exposed to the flu virus, most of the time the flu virus infection would go asymptomatic. It actually has been demonstrated in a flu watch study in the UK. But if you, on top of that, inject vaccine, it creates sort of a negative phase, a drop in antibody titers. Again, another window of vulnerability. So now that asymptomatic infection manifests itself as the flu. So if that is another possible explanation to why people.
Okay, we have a question over here, and then I'm coming to this section. You guys are all so eager.
So here in the Northwest, we particularly prescribe D3 over of the D vitamins, and you're suggesting a full D on your slides. And then the other question.
Sorry, what is a full D?
Well, there's D1, D2, and D3. So here in the Northwest, we like to prescribe D3 for people.
Well, D3 and D2 or anything is just a precursor for what is an active form. So then it gets transformed into 25D and 125D, and that 125D is what actually activates VDR. So it really doesn't matter what you start with, as long as you have active form eventually, and your own body will transform it.
So all roads point to China on that one?
Yes,
okay.
to Rome.
And then the other one too is, we were taught in school that like people would have shingles in their 60s and 70s, but we're seeing it happen with people in their 40s. And I don't know if that has to do with like a chickenpox vaccine or what's running around. I don't know what you're seeing in your practice.
Oh, well, I don't have a practice. I'm not a medical doctor. I'm a PhD. So, but there has been a theory that has been put forth by Dr. Gary Goldman, a PhD who was actually working for the CDC. And what he found was that when he was looking at the statistics of chickenpox after introducing chickenpox vaccine, he also saw that shingles was going up at the same time. And the CDC, initially, they were preventing him from publishing those results, so he had to fight them. I mean, he got fired, and there is the whole 9 yards. But eventually, he published his data, and that's what we are observing now, shingles happening more frequently and at younger ages, and even children sometimes get shingles. So normally, there are two reasons for why it happens. If you are immunocompromised, it's a risk factor for shingles to come up if you already had chickenpox in the past and you have that virus in your system. But now it's happening also in people who are not immunocompromised. And so the second theory is that possibly you need to get re-exposed to chickenpox from children throughout your adulthood. And that's why I think Dr. Paul Thomas is so grateful to all these chickenpox kids coming to his office, because probably it helps him keep his shingles down.
So in a sense, like because I've had chickenpox as a child and I've had shingles, but because my kids had the chickenpox vaccine and I wasn't exposed to it as a parent caring for my child with chickenpox, I was never re-exposed. Is that possibly?
Yeah.
Darn
Yeah, it was actually, there was a study back, before even the vaccine was out there. So they were looking at adults who never lived with kids or never had kids versus adults who were taking care of kids. The rates of shingles were different. So those who were living with kids, their shingles rates were lower. So, but another thing, there was another study. Maybe in the past we were relying on this exposure to keep shingles down, but there is another way to keep shingles down. There was a study where consumption of, I think they were looking at the fruit and vegetable features of supplying vitamins to you, that higher consumption of those were correlated with lower shingles rates. So now that we don't have this extra protection from exposure, we really need to work on our own immune system and the quality of nutrition to keep it down.
Okay.
I just wanted to get a reference for, I was very interested about the exposure to whooping cough decreased the AML. And where did you get that information? I would love to be able to access it.
PubMed, and if you contact me, I'll probably be able to find that reference for you.
Mary has a question.
Tatiana, as a pro-immune system advocate, how do you talk about herd immunity with people?
So I'm actually going to talk about it tomorrow in Orange County. So if anyone wants to make a trip there, you will hear the rest of it.
Disneyland is right near there.
Right.
Just saying.
Yes.
Just saying. If you want to get the measles, mumps.
Yeah. So I mean, I have a whole lecture on that. So I might either show you the slides later on, or I addressed a little bit of it already. But basically, in the past, like just a brief statement, herd immunity was sort of the components of herd immunity. Your whole population of adults was immune, 15 and over, huge chunk of population. And probably half of the kids would have measles by the time measles outbreaks comes to the community. So then that measles outbreak would convert another fraction of kids from being non-immune to being immune. And then the measles would not come back for 2 or 3 years. And that's because of that herd immunity. But eventually that herd immunity goes away because some elderly pass away and some new babies are born. And so the whole proportion changes. And now, again, you have that window of opportunity for the measles virus to get through another cycle. Now, if you instead of waiting for the outbreak to occur, you come into the community and vaccinate all the kids who haven't had measles yet, then for a short time, you are kind of mimicking a herd immunity, right? Because you are compensating for that percent of non-immunes with vaccines. But then over time, as we are vaccinating our population, and the exposure to actual virus goes away to the extent that now we only have imported outbreaks and no longer disease, endemic disease, which was native to this land, you remove all that huge proportion of adults from being immune to being temporary immune or no longer immune by now. So if you imagine an iceberg and the top of it, right now we have the top of it, but not the whole bottom. So we're pretending there is herd immunity. It's just like the top of the iceberg. It's not going to hold. And the longer we go, another generation, there will be fewer and fewer people who are actually naturally immune. So it's just not going to get any better.
We have a question here in the back.
Oh my gosh, so many questions.
One at a time.
Yes. Actually, on that same thing you just said, do you see a potential bubble that we talked about earlier with the suppression of natural immunity, with artificial immunity from the vaccines? Do you see, X amount of years down the road there being massive endemic diseases just rampant throughout the country?
Well, if they're doing their isolation and quarantine, I guess not. they would probably be able to contain things. But the thing is, do we really need to contain measles? You know, there might be a, the situation that we created that there is a reason for why we might want to do it, and that's in the past we had maternal immunity for infants that was covering 6 to 9 months of life, and so that infants would rarely get measles. Now that doesn't exist. So maybe for the sake of infants, we do need to do that. However, on the other hand, vulnerable populations like infants or immunocompromised, there is a solution for them that already exists, and that's post-exposure prophylaxis. So in a way, I don't think one way or another is so critical. If they want to do their isolation measures, fine. If something goes through, there is a solution for infants, and no infants died in the Disney outbreak because of that.
The question I actually was waiting to ask you was, when I was doing my nutrition studies, one of the classes we had was called The Politics of Cancer. And I remember one of the studies in particular talked about, there was a doctor, and I want to say this was like in the 20s, but he had a small community of people who had cancer. I think the tests was only like 6 people, but a flu went through. And even though like 2 of the 6 died from the flu itself, several of the others also got the flu so bad, but when they were over the flu, they actually eradicated the cancer from their bodies. So can you talk about the immune system's ability to adapt? I mean, I guess what they said was that they looked at, how severe it was, how high the temperature got. There were so many factors, but why isn't something like stimulating the natural immune system in that way? Because then you're preventing, some of those other more deadly diseases. Can you speak to that?
So, I mean, it could be a coincidental event to get something like the flu while you're having cancer. And if you're already immunocompromised with chemotherapy, that's not going to be a solution. First, because then you are immunocompromised, you can't deal with infection. And second, the fever itself might not be what kills cancer, it just resets that mechanism, and then your intact immune system has to come in and kill cancer. So if you already destroyed it with chemotherapy, then I don't see how fever is going to help. So, but these anecdotal reports are also about measles. Someone had cancer and they got measles, and after they recovered, the cancer went away. So it's happening anecdotally.
If I remember right, they didn't get sick for like the rest of their life. Like they never got sick again after that cancer and flu thing. Those particular like small group of people that survived.
Well, it would be good to know and to read more about about those cases.
Okay, we have one more question up here. I know people, but we're going to take a little break here. We're going to get the whole panel up here, and you can continue to ask questions. You guys are really inquisitive. Please.
So there's been a lot of talk online with like Marcella Piper Terry. She talks a lot about insertional mutagenesis, with the one thing that we haven't really brought up, which is the human diploid cells. Do you know anything about that, how it's leading to leukemia, and if they're even talking about that in the oncology world, or if there's any buzz about that, or is it just here?
No, that would be beyond my knowledge or scope of training, I guess.
Thank you.
Could we give a round of applause for our speaker?